My name's Quint Studer, Mom. Nick, Jessica, thank you for this opportunity. I live in Pensacola, Florida, but of course we have quite a few investments now in the Rock County area. Probably our biggest investment, people might think about the bodacious shops or they might think about the Sky Cart. I think our most important investment is the investment in children through the State Line Community Foundation, where we gave a $500,000 to them to really work on building a brain. So let me walk through why this is so important. And again, we're different in Rock County versus Escambia County. I first got involved in this in Florida when we did a dashboard. And we're very fortunate because Jeb Bush, when he was governor, put in standardized kindergarten readiness. So we know by school district, by school, what child's kindergarten readiness is. And we saw kindergarten readiness was quite low. And I was curious, did that impact third grade reading or fourth grade math? Well, what it came up is yes, it does. So that led us to the University of Chicago. Dana Susskind, who had written a book called 30 Million Words, and it really talked about the brain. Child is born, the brain is rather smooth. They hear words, they get neurons, it creates the divots, and those divots create the neuron hits the neuron hits the neuron, and 80 to 85% of the brain is developed by age 3. Now, the challenge, of course, is how do you get to these mothers and these children? Because though we spend a lot of money and a lot of time trying to make up for learning deficits and achievement in K through 12 or VPK through 12, which is important to catch kids up. But wouldn't it be even better to prevent it so we didn't have to catch kids up, or certainly as many children? So the way to build a brain, build a life, build a community got started is we met with Dana Susskind. We brought her down to Pensacola and we were talking, and she was saying that in Chicago, their goal is to get to every mom and show them a video on how to build the brain. It's a short video, 4 to 5 minutes long, and I've seen it, and it really helps people understand the power they have to build their baby's brain when 80 to 85% is built by age 3. With that, I just said, wouldn't it be cool if the hospitals all did it? So we're very fortunate here in Pensacola. We have 3 hospitals. We have about 5,000 births per year. And when a mother is in the hospital after having a baby, some do prenatal care, they watch a video. And we've also peer-reviewed research with the University of Chicago to show that we have an impact. So if you can, it's been challenging at times in certain cities, but if you can, the key thing is to get the nurse to sit with the mom and do a tutorial on how to build a baby's brain. Then when they leave with resources, a number of resources. And then what we want to do, what you're saying, is you build learning into the entire environment. Most playgrounds are built for physical activity. They're not built for building a brain. And of course, Nick and the library and the discovery system there is really focused on how do we do that. And that means not only when people come to the library, but also taking the library out to the community. So that's what Jessica has also done such a good job, is creating ways for wherever you go. We want when a mom or dad or grandma or grandpa are with a small child, they all of a sudden it clicks to them. They need to work on building the brain, which is really engaging in conversation with the child. Sadly, it's getting worse. It's getting worse because of the cell phone. Children are now hearing less words, not more words. So I think it's really vital, and it's vital for a community. Now, it's just a good thing to do. I started out as a special ed teacher in Rock County, Wisconsin. Of course, we want to maximize everyone's human potential. So there's just the value. Even if you said, well, it doesn't impact the potential workforce, but it does, we should still do this. There's just certain things to do because it's the right thing to do. We also know that it's the right thing to do for the community. This is your workforce. These are the people that you're going to be hiring. These are the people that could be raising your children. John A. List, who actually spoke at the Beloit College a couple of years ago, is the most downloaded economist in the world from the University of Chicago, wrote the foreword to my book, Building a Vibrant Community. And what he says in there is, if you want to know the future of a community, look at kindergarten readiness. And it's one of those numbers that we haven't paid a lot of attention to. Now, public education gets sometimes a lot of hits. But in reality, if a child's not ready for kindergarten, we're putting a big weight on these public school teachers who work so hard in order to catch those children up. Again, I don't know the kindergarten readiness in Rock County. I haven't seen the measurement. I just know across the country, it's usually pretty low, depending, of course, on what tool that you use. So I think it's exciting. We're exciting now to donate money for the library's PLAYce. PLA, capital PLAY, small CE. We just gave a small donation to the library we're excited about, but we're even more excited about your work, your commitment, and truly making something different. So let me close with this. When I first got into this, there were some questions on, well, but these are all these single mothers, or this is just a poverty issue or a race issue, and so on. And I remembered a story by Dana Susskind. So Dr. Dana Susskind, a cochlear implant surgeon at the University of Chicago, basically talked about, and I've learned this story. When I met her, she's a widow. She's now remarried after some years. She's a widow with 3 children, and her husband was also a physician at Comer Children's Hospital. And you can go online and hit Dana Suskind's husband, and you'll see news reports out of Chicago. They were walking along Lake Michigan, and 2 children were struggling in the water. Dana's husband immediately jumped into the water to save those 2 children, which he did. He saved those 2 children. They are alive today because of what he did. But in saving those 2 children, he drowned himself. When he came up out of the water, of course, Dana was doing everything she can to save her husband's life, and she couldn't. When they were interviewing her, somebody asked the question, why did he jump in when those weren't his children? And Dana said, because he saw every child as his child. Isn't that what this is all about? Seeing every child as our children? So thank you very much for making a difference. And don't underestimate the difference that you're making. This is Quint Studer.